Hello, welcome back once again to Nursing with Annie YouTube channel, where I film content about nursing, health, lifestyle, and I also give nursing tutorials to make nursing easy and enjoyable to learn. Yeah, so from the last video I made a video on question 1 of paper 1 of the last exams that was taken in May, nursing council exams, and the paper 1 was centered on bronchial asthma, the nursing care plan, and everything that has to do with bronchial asthma basically. And I said I was going to make a video like a continuation, and this is number 2 question of the May 2022 nursing council exams, which was centered on nephrotic syndrome. So in today's video I will be teaching you about nephrotic syndrome in relation to the question that was asked in the last council exams. So if this is a video you're interested in, sit back, relax, and enjoy. So you're welcome back. I'll be reading out the question. It says, Master Peter, a 3-year-old, is admitted into the pediatric ward with the diagnosis of nephrotic syndrome. A. Define nephrotic syndrome. Okay, so let's get to that. Define nephrotic syndrome. What is nephrotic syndrome? Nephrotic syndrome is actually a condition in which there is the damage to the glomeruli of the kidney. If you are very conversant with the anatomy of the kidney, you know that the nephron is the basic unit of the kidney, and this is how the nephron looks like. Yeah, something like this, you know, with the, and so here is the glomeruli. So when there's a damage to the glomeruli here, this is what causes nephrotic syndrome. And we all know that syndrome means or is composed of signs and symptoms. So when one presents with nephrotic syndrome, the person starts to exhibit some signs and symptoms like general edema, proteinuria, hyperlipidemia, hypoalbuminemia. Yeah. So this person, it basically occurs in children. And to give you an idea on that, the question actually said Master Peter. So when someone is answering master, you already know that this person is a child. It occurs mostly in children. Yes, it's very common with children. So it is a condition whereby there's a damage to the glomeruli of the nephron, and then leading to some signs and symptoms like general edema. Reason is because there is fluid shift from the plasma into the body tissues. The person begins to present with proteinuria. Reason is because proteins are being lost from the glomeruli because this place is already damaged. Thereby, proteins are being lost from here into the body, causing protein to be present in the urine. And there is hyperlipidemia. There is also hypoalbuminemia. Reason is because albumin is now reduced in the blood. Albumin is now reduced, so there will be hypoalbuminemia. Yeah, so that's basically what nephrotic syndrome is. Then B says, outline 6 causes of nephrotic syndrome. Nephrotic syndrome can be caused by diabetes mellitus. It can be caused by acute glomerulonephritis. That is glomerulonephritis that was not treated properly. It can also be caused by sickle cell disease. It can be hereditary, familial tendency. Yeah, it can be caused by nephritis. It can be caused by diabetes mellitus, and so on. So they were asked to mention 6 causes. I've mentioned like up to 7. Then C, list signs and symptoms of Master Peter's condition. I've already listed it already. We have general edema, we have proteinuria, we have hyperlipidemia, hypoalbuminemia, we have malaise, ascites. This person begins to feel weak. This person begins to, have ascites. Headache due to malfunction in the CNS, irritability in the central nervous system. Irritability also can be present in the signs and symptoms. This person begins to become irritable, and yeah. Then describe the nursing care you will render to Master Peter while on admission. But before that, let me quickly go into the pathophysiology of nephrotic syndrome so you can understand better. Like I said, there's a damage to the glomeruli of the kidney, the glomerulus. There is a damage. Like I was saying, there is damage to the glomeruli of the nephron, and this, because of the damage, there will be increased membrane porosity, like I I've already stated there. There will be increased membrane porosity, substances begin to leak out from the glomeruli. Substances like protein begin to leak out from the glomeruli, leading to proteinuria, that is protein in the urine. You begin to see this protein in the person's urine, and because of that, the protein helps in the body tissues. There will be fluid shift into the body tissue, and this fluid shift now from the plasma into the body tissue will lead to edema. You begin to see this person present with edema, swollen limbs, swollen hands, swollen legs, swollen face, and reason is because of the reduced plasma volume. Because there is now a shift in the plasma volume into the body tissue, there will be edema. And due to this shift and the reduced plasma volume, there will be stimulation of aldosterone. And because of this stimulation of aldosterone, we will now have retention of sodium and water. That is what will now cause that edema. So this edema will lead to stimulation of aldosterone, and then because of this stimulation of the aldosterone, the body trying to help, how will I put it, like a negative feedback mechanism, there will be retention of sodium and water. And we know what sodium and water does in the body. So there will be reduced sodium and water in the body. This is what causes nephrotic syndrome. So yeah, that's basically the pathophysiology. Damage to the glomerulus, increased membrane porosity, proteinuria, fluid shift in body tissue, edema, reduced plasma volume, stimulation of aldosterone, retention of sodium and water. So in case you're asked in the exam to, state the pathophysiology of nephrotic syndrome, you can actually use this flow chart to write something and get your mark. So that is that. Now to the next question, describe the nursing care you will render to Master Peter while on admission. For that, I will be using an acronym. I said, describe the nursing care you will render to Master Peter while on admission, 7 marks. So it means they are not asking for nursing care plan. It means what they want you to actually write for them is the nursing management. I think so, because he has 7 marks. Meanwhile, in nursing council exam, nursing care plan goes with 9 marks. So I don't think they are talking about nursing care plan. I think they are talking about the general nursing care you give to these patients, which boils down to nursing management. And when it comes to nursing management, you have to include the medical management, because as a nurse, you are going to prescribe drugs to these patients. Yeah. So there is an acronym for nursing management, which is APOSHIDERAF. Yeah, that is the one I was taught in my nursing school. There are other acronyms, but this is the one I use in exams. This is the one we were taught in nursing school. So yeah, APOSHIDERAF, and the A stands for admission, the P stands for position, the P stands for psychological care, the O stands for observation, the S stands for specific care, the H stands for hygiene, the I stands for the investigation, that is diagnostic evaluation, the D stands for diet and drug, the E stands for elimination, R for rehabilitation, A for advice on discharge, and then F for follow-up. So if you're asked to write nursing management or nursing care, this is basically the acronym you should use to give you the full marks you are supposed to get. So this will guide you and help you on how to manage or care for a particular condition in a patient. Now, when it comes to admission, you as a nurse, you know what to do. You have to admit this patient when the patient comes to the ward, welcome the patient, introduce yourself to the patient, and tell the patient your name to make the patient feel comfortable. Introduce yourself to the patient relative, because this is a child and this child will be coming with the parents, so you have to introduce yourself, and then you take the patient to the patient bedside, arrange the patient's properties, keep them safe, show the patient relatives around, show the patient around the toilet, the bedroom, give details about the ward, visiting time, when the patient relative is supposed to come and check on the patient, and all those stuff. Then position, you have to position this patient in a position that is suitable for the patient. We like saying comfortable position, but I was taught, or we were rather cleared concerning this positioning. Using comfortable position is kind of I don't know, but it is good to use suitable position like this, the position that is suited, because a position can be comfortable for a patient but not suitable for that patient. I don't know if you understand. Like a patient might find a particular position comfortable, but it might not be suitable for the patient depending on the condition that patient has. So you place the patient in a suitable condition according or in regards to the patient, the condition this patient is going through. Yeah. Now, psychological care, this has to do with reassuring the patient, telling the patient, oh, don't worry, you're in a safe hands, you will be fine, you will get better. With treatment, you're going to be fine. You also reassure the patient relative, you know, help this patient. If the patient is down, if the patient is depressed, you give psychological care. Then observation, this has to do with monitoring of vital signs. And because nephrotic syndrome is a peculiar condition whereby this patient loses protein, and protein is observed in the urine, the patient has edema, weight gain, so you have to monitor this patient. This patient has to be on very close observation, monitor the temperature, vital signs, the temperature, pulse, respiration, most especially the urinalysis. You have to carry out urine testing on this patient every day. You have to carry out urine testing on this patient every day. You have to check this patient's weight every day to know the progress of the patient. Now, specific care, this it also boils down to, like I said, this is a peculiar condition. So you use specific care for a condition whereby you feel like there is a specific care you need to give a patient, depending on the condition this patient is going through. So you have to, you know, give specific care. Like I said, monitor this patient's vital signs, especially the urine. You have to carry out urine testing every day. You have to check this patient's weight every day. You have to check out for pressure areas in this patient every day because of edema, in order not to, you know, allow this patient to have breakdown or have pressure sores. Then hygiene, you have to encourage this patient to, you know, take his or her bath, brush his or her teeth, maintain personal hygiene, look fresh and clean, because it also helps in recovery. Then investigation, this is where you carry out diagnosis evaluation like physical examination. This has to even come before any other thing. Yeah, so you do investigation, physical examination, carry out the necessary lab tests the doctor has ordered, help the patient navigate through it. Physical examination, that is from general assessment from head to toe. You also carry out kidney analysis, you carry out urinalysis, which is very, very important. Urine testing, very important in this condition. You carry out blood chemistry, and also ultrasound may be involved. Then when it comes to diet and drug, you have to give this patient food that contains enough protein. Reason is because this patient is losing enough protein already, so you have to replace the lost protein. You also give this patient food that has sodium, and because this patient is also losing sodium, you have to give this patient food that has sodium, and then in medium quantity. Yeah, in medium quantity. Then when it comes to the drug, you give this patient furosemide. The doctor will prescribe the drug. What you have to do is to administer, and I'm very sure that furosemide will be among the drugs that will be administered, which is also known as Lexis, and then prednisolone will also be administered in the right dosages. So yeah, you give the patient that. Then when it comes to elimination, if the patient wants to go to toilet, wants to urinate, you have to help the patient out with bedpan. If the patient is able to go to the toilet his or herself, you assist the patient in doing that. Then rehab. This particular disease, I don't think it really needs rehabilitation. Yeah, there are some conditions that need rehabilitation, but not this. Now, when it comes to advice on discharge, this is where you encourage the patient, you know, to take his or her drugs. Because this patient is a child, I think the advice on discharge goes to the patient relative, either the mother or father. You advise the patient relative to help the patient always take his or her drug, follow drug regimen. Also advise the patient relative to always carry out urine testing on this patient, and also check this patient's weight gain in order to monitor the patient and know when this patient is relapsing and know when this patient is getting better. Then follow up. This is meeting up with the doctor's appointment. It can be in 2 weeks, 4 weeks, depending on when you were given appointment by the doctor. You have to advise or encourage the patient to follow up, with the treatment. So that's that for the nursing care. Then the E question says, state 6 preventive measures of nephrotic syndrome. What do you do to prevent nephrotic syndrome? Then the last one says, outline the advice you will give to Master Peter's family on discharge, which I've already done in the follow-up. Now let's go to the 6 preventive measures of nephrotic syndrome. So nephrotic syndrome cannot really be prevented, but one thing or the other can be put in place to prevent it from occurring either again or recurring at all. And the number one thing is treating underlying kidney disease. For example, like in the previous, when I was talking about the causes, I said one of the causes is acute glomerular nephritis untreated. So it is very important that any underlying kidney disease should be treated. And also maintaining hygiene should also be in place. Maintain hygiene to prevent infection. Another thing you can do to prevent nephrotic syndrome is taking low sodium diet, because those high sodium diets can be dangerous to the kidneys. So you have to take sodium diet in minimal quantity, in low quantity. Taking enough protein will also help, and also taking enough water would also help to prevent, because water is very good for the kidney. We underestimate the power of water when it comes to our kidneys, but water is very good for the kidney. So taking enough water would also help. Taking fruits and vegetables would also help to prevent nephrotic syndrome. So that is that for number 2 question in the last May Council exam. Another thing I want to add is the nursing diagnosis concerning or relating to nephrotic syndrome, because when, like I said, in nursing diagnosis, if you watched my previous video, I said in nursing diagnosis, what you work with is the signs and symptoms that was presented in the condition. In this particular condition, there was no signs and symptoms presented, but you can actually make up the signs and symptoms, because you already know what the aftermath of nephrotic syndrome, what comes after nephrotic syndrome. We know there will be edema because of the release of plasma into the interstitial tissues. There will be malaise due to weakness. There will be headache, irritability, and all that. So because of this edema, there will be the number 1 diagnosis will be excess fluid volume related to increase in the intravascular volume. There will be excess fluid related to that, evidenced by what? Edema. So most times the evidence of your nursing diagnosis surrounds the signs and symptoms. So evidence by edema. Another is pain, headache related to the irritability in the CNS, related to disruption in the CNS, evidenced by headache, or evidenced by not evidenced by headache, evidenced by patient's verbalization or patient's facial expression. One thing that comes with pain, the evidence you use to know that someone is in pain is either the person verbalizes it or the person's facial expression is not good. So you should also know that patient's pain related to malfunction in the CNS, evidenced by patient verbalization or patient's facial expression. Then you also have self-care deficits. Reason is because this patient will be so weak, there will be general malaise. So the self-care deficits will be related to what? General malaise, evidenced by inability to perform activities of daily living. We also have high risk for infection due to immunosuppression in this patient. So that's that for nephrotic syndrome. Hope this video was helpful. Hope you've learned 1 or 2. Don't forget to subscribe if you have not subscribed to this channel. Like this video if you've watched to this end. Give it a thumbs up. Share this video. Drop your comments. Ask your questions. I'll be willing and ready to answer you. And I'll see you in my next video. Until then, I still remain nursing with Annie. Until then, I still remain nursing with Annie. See you in my next video. Bye.